Hi, everybody. My name is Vince Moffitt. I'm the CEO and owner of the Basin Health Companies. Welcome to our very first podcast. It's going to be all things community, healthcare, and things about Basin as well. So joining me today is my friend Tyrell, friend and employee. Hey, Tyrell, welcome.
Hey, thank you for having me.
Yeah, thanks for being here. So I just want to have a little bit of a conversation, and I think for starting out, you're one of our newer employees, which is probably why you're here. Sorry to drag you into this as a I guess this is almost like hazing, I think, maybe.
No, I'm happy to be here.
Well, good. Well, I'm happy to have you here and happy to have you on board. So why don't you start off, just tell the listeners about who you are and what you do.
Sure. Well, my name is Tyrell, and I am originally from Two Gray Hills, New Mexico, which is on the Navajo Reservation, but I currently reside here in Farmington, and I've been here a community member for 10 years now. A little bit about my background. I specialize in healthcare administration. So back in 2012 is when I got started, and I started out at a small clinic in Salt Lake City as a receptionist, and I did that for a good 3 years. Then I came back down to the San Juan area, and that's where I kind of started moving my way up in the healthcare industry. So I worked for San Juan Regional, I worked for Presbyterian Medical Services, and now eventually for Basin Home Health and Hospice, which I am thoroughly enjoying since I've started on the team. And my background, I have a master's degree in public health. So basically what that entails is that I look at population health on a bigger, grander scale. That kind of interested me when I was at Presbyterian Medical Services, because while I was there, I was actually serving as a business office supervisor. So I wanted to level up and learn a little bit more about leadership in healthcare. But I also took a big turn, and I actually went into car sales as well. So
Wow, that's different.
it is, yeah, it was totally different. Learning sales, marketing. I felt like that was a place that I could really level up my skills in a sense, because I've heard before that, you're successful as long as you know how to sell and market in the world. So that's why I did that. I did that for a good year and a half before joining Basin Health Companies. And while I was there, I really wanted to get back into healthcare. I wanted to start serving my community in that way again. And then when I saw this job posting come up, I was excited. And going through the interview process was amazing. And I'm just really happy to have joined the team.
Yeah. You know what I love about your story is that you grew up here, went away, got a master's degree, and you came back. I mean, that's the type of story that we want people in this community to hear, because, a lot of the things that I'm about is trying to create a culture and a community where it'll keep my kids and my grandkids and other people's families and people from the reservation that go to school to have something to come back to. So you're a testament to that.
Exactly. And it was my mom, my late mom. She passed away in 2006, but when I was growing up in elementary school and middle school, I was pretty good at school. I was getting good grades there, and she always told me, "Son, when you go to school, when you go to college, always come back and start serving your community." So that's what I did.
Man, that's great. Well, I'm glad you're with us, and you've been a great addition to our team so far. So welcome to Basin, and welcome to your first podcast.
Thank you very much.
Yeah.
Yeah, and tell me a little bit about your story.
Oh, well, my story. Well, I didn't get a master's degree. So I was born, and I like to say I was raised in Farmington, but I lived here until, I was like in third or fourth grade, and then we left. But my family was all from here. My grandparents, my aunts and uncles, my parents, and we traveled around. We went to Alaska, Arizona. We were in Mancos. We did different things. And eventually we came back, and I followed my family back. They left for a while. And I met my wife, and who we're now divorced, but we have 3 amazing kids. That family that still, even though that her and I had separated, we're still all very close, a family unit. I worked for the fire department, and I spent a career with the fire department. Retired from them in 2010 at the rank of battalion chief. I was the training chief for them, my kids grew up here. They were raised here, and it was just a great community. I loved it a lot. After I retired, when I was working for the fire department in 1997, I started a rescue training business. So I did technical rescue training, which is things like floodwater rescue. We call it swiftwater rescue, confined space rescue, industrial rescue, building collapse, things like that, technical rescue. And so when I retired from the fire department, I did that full time, and I loved it. Traveled the world, got to work with the military, police, fire, all over the place. Really found my passion, but I miss the response of the fire department. I mean, it's just kind of one of those deals that once you've done it, you do miss it. I found an organization called Team Rubicon that they did disaster response, but it was different. And they took veterans and first responders, and our goal was to help veterans reintegrate into civilian life through continued service, disaster being the service. And so I did a lot of work with them as a volunteer, and went to some large disasters. When Hurricane Sandy, there was a tornado in Oklahoma, Moore, Oklahoma, that was very devastating. Hit an elementary school. Some of the elementary kids, school kids actually lost their life in that. And so I got to go up there and work that. And it was the largest response I ever had. And I was instant commander on that. And really got to work closely with our headquarters team, and they offered me a job as a director of operations. So I jumped at it. I love the organization, and the disaster response thing and veterans and first responders are right up my alley. And when I was there, I ended up building a program called an incident management team, which is real similar to what we do in the fire service for large-scale disasters. So, I'd worked with FEMA before. I had responded like Hurricane Katrina in New Orleans after the flood, and Hurricane Rita. Had gained a lot of experience stuff working with them. And that incident management team concept, I thought was something that would apply to what we were doing in Team Rubicon, especially with the background of first responders and military. And I became their very first incident management team chief, is what the title was at the time. And my job was to go out and either help run a disaster using a team for the command and control is what we call it, logistics, feeding, billeting, moving people, collecting data from the disaster so that they can better utilize it with FEMA for reimbursements after the disaster's over. Because a lot of those places aren't aware how to do that. And we'd go into these different incidents and we learn how. So, but the main goal, and this is really something that helped me grow as a leader and people, is mentoring and coaching others. So what we did is we literally would go in there and we'd identify people had this training and the skill set, but they hadn't utilized it yet. And we just mentor them through the disaster to build depth in the organization. So our team wasn't the one necessarily that always ran the incident. We were mostly doing mentoring and coaching. I loved it. And anything that happened around the world, I get to go. So I've been to, earthquakes in Nepal, typhoons in the Philippines, anything that happened in the United States, got to work with, different emergency managers, things like that. But my story shifted in 2016. Basin Health Companies, which we're involved with now, was my family business, and they started in 1992. And it was my mom, my dad, my ex-wife, and one of their friends, and who actually helped finance the business when we first started, was their receptionist, and the four of them. And eventually my sister got involved. She was 2 years younger than me. And she worked for them for probably at least 2 decades. And when my mom and dad finally decided they wanted to retire, my sister was going to buy the business. And she was working towards that. And I think they started that process in 2015. And unfortunately, in 2016, combination of stress, I think, mental health issues, substance abuse, who knows what happened, but my sister passed away.
I'm sorry to hear that.
Yeah, it was traumatic, as you can imagine. Any death is, but especially in circumstances like that, it was really hard. And my parents had basically semi-retired at that point. And so after, the funeral and the dust settled and all that stuff, and my parents started looking at the next steps for their business, and they had a lot of employees. I think at the time they had about 600 employees, close to it. They called me and said, "Hey, I think we need some help." And so I had to do a lot of soul searching and really decide if I wanted to change my life that much. I wanted to come back to this type of office environment, this type of work, and doing something totally different. I had lots of management experience, had some great mentors and coaches of myself, working with Team Rubicon, especially through the fire service, been in that next transition. So I did what I think most people would do, and they helped their family. And so I came in and was going to step in as the CEO of the business, and I realized everything I had to learn with the industry, so much compliance and regulation and all this stuff, that it wasn't going to be something that was just as easy as just kind of coming in and just putting a Band-Aid on it. So I bought the business. In 2016, I was all in, and I allowed my parents to help them retire, and it was like drinking from a fire hose. There's many times that I was wondering if it was the right decision, especially with all family businesses and dynamics and just all those types of things. But I've really grown to be passionate about it, and probably in many ways have the same passion I had for the fire service and disaster response, which was this whole other side of my life, now with this business. And yeah, I love it. And now I have my kids involved, and they're working for us, which I'm sure we'll talk about a little bit. But it's been a really good thing for me and my family. Under the circumstances, I wish life would have been different, but I'm really glad that I'm here and part of Basin and be able to sit at this table with you.
Well, like I said, I'm sorry to hear about your sister. And that's basically how you got involved in the business. But I totally appreciate, having you as a leader in the organization. So I'm really grateful for that.
Well, thank you. I'm glad to be here. Yeah.
Thank you for sharing your story. So I want to just shift a little bit for the listeners here and kind of discuss what Basin Health Companies is.
Okay. So, I think a lot of people maybe don't understand what we do because we're in people's homes all the time. I think right now we're the largest private employer in Farmington and San Juan County. We have right around 800 or more employees. We're in 3 different locations: Farmington, Gallup, and Grants. And we have 4 different aspects of what we do. One of them, which was the first business that they started, was Basin Home Health. And home health was really designed to go out and help somebody who maybe came out of the hospital after surgery or some sort of injury, to help them get better and then continue to live their life. And I will point out that everything we do is designed to keep people in their home to live independently. Home health is designed to make them better: physical therapists, skilled nursing, home health aides. And we're usually in there for about a month, maybe 2. The person becomes more active. They learn how to live with their injury, or they heal from it, and they can go on. They're always homebound, meaning that it's hard for them to leave their home. It's a taxing effort. Sometimes they can't leave their home, and we just help get them to the point where they can.
And also with home health too, we prevent them from being rehospitalized. That's a really big part of it.
Yeah, that's a really good point. I think our goal in everything we do is to keep people out of the hospital. And that's the way it's designed to do, is to hopefully allow people to escape that and be able to live more independently and not go back to the hospital. So when they come out of the hospital, we want to keep them from going back. Partnering with the hospital in that regards, and the primary care providers in many situations.
Yeah, and I think that's really important because access to healthcare around here is very limited. And so, if we have people not utilizing home health in the right way, they're filling up the emergency rooms constantly. And I think that's really important.
Yeah,
Work
absolutely.
that we do.
And, a lot of the times people maybe aren't appropriate for home care. So an example of that would be someone comes out of the hospital, but they need a higher level of care. So they need more care. So, with home health care, they're going to get a physical therapist or a nurse maybe 2 to 3 times a week. But they need to be doing their exercises. They need to be doing their, whatever the care is that the nurse and the therapist is providing for them. Sometimes they need a higher level of care. So a lot of times it might be more appropriate for that patient to go into a skilled nursing facility or a rehab facility for a short period of time. That way they get that, they have someone available to them 24/7. They actually have someone to do all the exercise with them every time they do it. And then they go home, and then they're more appropriate for home care. So it's the continuity of healthcare, the way it works together. I think what we run into a lot is like maybe people don't want to go into that rehab facility because they want to be home. Well, we can help them with that if they use the process correctly. And sometimes a short time in a skilled nursing facility or rehab facility, and then home health in the home, and then they're no longer going to be returning to the hospital. If they bypass some of that, a lot of times what ends up happening is either they're not appropriate for home care, or they try home care and it's not the right avenue, and they do end up back in the hospital. They have further injuries, things like that. So that's home care, which is one of the things we do. We also do hospice, which, hospice is someone who's got 6 months left to live. They're terminal diagnosis, so no longer receiving care. And we go in and we help provide care for them with nurses, social workers, a chaplain, home health aides, all the wraparound services. We work with the pharmacists, nutritionalists to help that person live as comfortably and as long as possible. Statistically, they show you the earlier you go on hospice, the longer you're going to live. And I'm not going to get into a lot of that stuff, but we really are walking the patient, and it's as much about the family as a patient through that end-of-life process. And I'll tell you, that's a powerful thing, because every patient that we have, we know that eventually is going to pass. They're not going to probably get better. There's going to be some decline. But if we do that right, they have more quality of life, and they're going to have more days left in their life if they choose hospice. So that's something we do as well that we love and we're passionate about. Then the other business line, which is a huge part of what we do, is mostly a Medicaid program. But all the patients that are involved in that program are chronically ill. They're not going to get better. And so they're actually nursing home certified or long-term care facility certified, meaning they need a higher level of care for the rest of their life. So what we do is we save taxpayers money. It costs about a third of the cost it would go into a skilled facility to keep that patient at home. And we use caregivers to help take care of that patient, and we employ the caregivers to take care of that patient. So a lot of times they're even family members. So now the family member doesn't have to stress out about going in a job, paying for someone to take care of them or putting them in a nursing home. They care for them, they can focus, and they can continue that relationship with their loved one and take care of them. And it's simple things, bathing, maybe help change depends, maybe they help transition the patient from their bed to their chair, preventing falls, making sure they're taking their medication, making sure they're going to doctor's appointments. But all those things are designed to keep the person out of the hospital and have a better quality of life, live more independently for longer. I love that thing. And that's the big part. When I started, I said, we're one of the largest employers, and people don't always realize that because all these people are working in people's homes, every one of these employees. And then the fourth piece is that one piece of the patient who doesn't have care, they're not Medicaid, which Medicaid is the only, unfortunately, some long-term insurance that provides caregivers. So we provide caregivers for someone for private pay, and does the same thing, and it allows that person to stay out of a nursing home. So this could be someone who is elderly. A lot of our patients are elderly, and they're not ready. They want to stay at home for as long as possible, and they can do it with the caregiver, and we can do that. A lot of times our caregivers will go and help our hospice patients, to help the family, to give them some respite, and to help them care for their loved one. So we hit all four angles of that in our businesses.
Yeah, and I know we have the Good Neighbor Foundation too, which helps hospice patients who may not be able to afford hospice care.
Yeah, I'm glad you brought that up. I always forget to mention that part. So in 2018, I started that. It's a nonprofit foundation, and really it's designed to do exactly what you said. Someone who's underinsured or aren't insured to still receive hospice care, because we saw that indigent patients who don't have the ability to, so for example, Medicare pays for the majority of hospice. There's a lot of people who are terminally ill who are not at Medicare age. Their insurance didn't have a hospice benefit, and then they find them in an unfortunate situation with a terminal diagnosis. So we can provide funds for that. Or maybe they do have the ability to have Medicare or something like that, but they've exhausted all their other funds fighting the disease process, and now they need some help with utilities or changes to their house because maybe they didn't have a wheelchair ramp or something like that wasn't accessible. So we can use those funds for that. And that's why we started that foundation. We have an executive director that manages that, 501c3. And really proud of that foundation. It's the only one like it. I think there's only 2 of us in the state, but all our funds for that serve hospice patients in San Juan County. And the patient, by the way, can use any of the hospices in town. There's 3 other hospices. They can use the funds for that, freedom of choice. It's available for them as well. Maybe caregiving. Maybe they need caregivers and the family can't afford the caregiving. So a lot of aspects with that.
That's amazing. Yep. And that's what I was going to say is that, the Good Neighbor Foundation, you don't even have to be a Basin patient to utilize that resource, which is just amazing to have that resource here in our community, because there are a lot of people out there who fall into that category where they can't afford hospice care.
Well, and one of the other cool things about this that we're working on is we're exploring the possibility of a hospice house. Same thing. It'd be a place for people to go if they, one, don't want to die in their homes, which there might be many reasons for that. One of them might be culturally. Here with the Native American population, a lot of the Native American beliefs surround, kind of this avoidance of the word death and the whole process. And so, I don't understand it as much as probably you do, coming from that culture, but it's almost like it's taboo for the person to die in the home. So it'd be a place for them to be able to go. Right now, that's a huge missing piece in our community. That house would be totally free for any hospice in our community to use, and we're looking at structuring that through our nonprofit right now.
And I'm really excited for that program too, because recently we went out into the community to our referral resources, and they were excited to hear about that. They understand that lack of resource for the Native American community, but also other communities out there, or people who might not necessarily want to have their loved one pass away in their home.
Yeah, and there's really not a resource like this around. There's a nonprofit hospice house in Albuquerque. There's one in Santa Fe, and we visited those. We've joined a national association to help us guide us in this process. And right now, we're just looking for the right place to be able to do it. And we're raising funds. I mean, there's a lot of fundraising we'll have to do before that'll come to fruition.
Amazing. I get good compliments from throughout the community when I go talk to them about Basin Health Companies. They love the variety of resources and services that we provide. So I want to shift gears a little bit, and I want to maybe show the listeners what are some of the biggest misconceptions with our home health and hospice industry that you can think of.
Well, probably one of the biggest ones that we talked about earlier is that someone can just go out of the hospital and go straight to their home, and they're appropriate for home care. And like I said earlier, that's probably not always true. I think a lot of times that patient is going to need a little bit higher level of care, which the whole system's designed for that. And that's where the rehabs and skilled nursing facilities come in handy. I think the other one is the fraud aspect. Right now, especially with the Trump administration, you're hearing a lot about fraud in hospice, hearing about DMEs. We've heard about the story with the daycares in Minnesota, the DMEs in Florida, the hospices in California. That is a reality, and that stuff does exist. But home health care, hospice care, all these other services, they're really funded through government programs like Medicare and Medicaid, actually save taxpayers money. I always tell people it's so much cheaper to prevent a broken hip than to have to treat a broken hip. Those procedures, one, a surgery is very expensive, and everything that happens after that can actually help expedite death. It just brings those things on sooner, especially for our elderly population. So, anything we can do that keep people healthy and independent and using the services appropriate is the best thing. So I will say that's one of the things when people think about Medicaid and they think about the money that's being spent for like our program and Medicaid, we're saving taxpayers money. And in the end, we're creating jobs, which I also think I'm so proud of what we do. We're hiring people. They're getting paid for through that program. Our Medicare and Medicaid reimbursement rates aren't the best, but I would imagine the majority of our employees, which 800 strong at least, are spending probably every dollar that they make almost in San Juan County, in the communities that they live, on rent, utilities, our local grocery stores down here on Main Street, going to Walmart. So I think that's a really important aspect too, is it actually is an important part of our economy as well.
Yeah. Once I started working, this is my first home health and hospice, job that I've had. And I just learned how tightly regulated it is. And that's the reason why, we can't always take on every patient because they're not appropriate. And there are these CMS requirements for home health in that regard. So we're navigating that as best as we can with our intake team.
Yeah, and I think a lot of people ask me what CMS is, but they rule everything we do. But this is the Center of Medicare and Medicaid Services. But absolutely, the regulation that's behind it, it's one of the things that kind of scares me right now when they talk about fraud, I'll be honest, because, we do everything we can to, all the companies have been around. We're surveyed. We're mandated to be surveyed at least once every 3 years. We get audits on our charts. We get all that stuff to kind of root that stuff out. But you make a mistake, and it might happen on occasion, and then you have to prove that it was truly a mistake, and it hasn't something that, that was done intentionally or whatever, and it wasn't fraud. So there's a lot of scrutiny on these agencies, so it's really important. One of the things that I'm really proud of, and this has happened recently, and I know you've seen this and you've been part of this, but we are now a CMS 5-star rated agency. So our home health care is 5-star. Our hospice is 4-star. That 5-star puts us in the top 4% in the United States of agencies based off our quality outcomes. And those are, we've done a lot to work towards that, but it's a lot of it has to do with our team and our processes and having to make changes to be able to get to that point. I told our team when we started going through this, it wasn't like just changes. We actually tore everything down and rebuilt it from the foundation, breaking habits and things like that. But it's helped ensure that we're durable and that we're going to move on and that we're providing the right care for these patients, and we're doing our best to keep them out of the hospital, which is one of the ratings there. So really proud of the work we did that. And I think our community should be proud. I mean, to be in the top 4% in the country and to be right here, doesn't mean that we're always the right fit for everybody. And there's other agencies that do that work too. And I love the fact that they're here. I mean, they're all doing great work, but I'm proud of our team and what they're doing.
Yeah. Ever since I started working for Basin, the leadership in all the programs that we have, I know they do an excellent job, but I also think that's a reflection of, your type of leadership. So tell me a little bit about how you, what type of leadership did you develop and how?
Well, that's a good question. So, a lot of that came probably from my background, starting with the fire service. Obviously I had great leaders, had leaders that maybe I don't want to be so much like that leader. Everybody's been through that, right? Coaches and things like that in your life. And as I grew up in the fire service and I became a leader and, as a captain and eventually a battalion chief, I'm sure I missed the mark a lot too, and learned a lot through there. And then when I went with Team Rubicon, I really got exposed to some amazing examples of strong leadership. We were on our advisory board and our board of directors, we had multi-billion-dollar companies and the CEOs from those companies. We had General McChrystal and General, Petraeus and, presidents who would come through there and all these people. And they taught us a lot about these different aspects. And I feel blessed to have that exposure. And then crisis leadership, when you go into disaster and you're dealing with life and death decisions, you just learn a lot. So I think the takeaway there is service-based leadership, setting a tone, one, picking the right people. I don't know everything about everything for sure. I don't even probably know a little about a lot of things, but I try to hire people that are smarter than me and empower them and give them the tools and the resources to be successful. Do I have things that I want done my way sometimes? Yeah, absolutely. But, really trusting your people and empowering them to get the job done, I think is a big thing. Probably the biggest part of that is my customers are not our patients. My customers are my employees. And we really try to stress that in our leadership team is that our employees are our customers. And if someone had to come to customer service and you're managing customer service at Dillard's or something like that, and someone with a complaint, how would you treat that person if you wanted them to come back? That's the way we should be handling our employees. Then there's a trickle down. So if we're doing that right, then eventually they're going to be doing that with our patients who are their customers. So I think that's the biggest thing is really stressing that. We have strong values that we follow. Empathy, kindness is a big part of that. Professionalism, honesty. We make sure that when we coach and mentor, and sometimes we have to discipline, that we look at those values when we talk about it. I love the culture we developed, and I tell a lot of people, culture's king, and, trying to develop that a place that, provides a lot of flexibility and, just really honors the people that are doing the hard work. So I think that's probably, if I had to put it in a nutshell, part of those things, though, have really worked to our advantage. For one thing, our employees stay, even though they can maybe find different jobs that might pay them more or something like that, or they leave and they come back. We are a platinum level family-friendly New Mexico company, which is a nonprofit that helps rate companies based off of their policies and their procedures and things like that. I'm sit on their professional advisory board. Part of that is because, one, I think we're doing some good things that we want to share, but I'm learning from those people too. I'm the past board president of our state association for hospice, home and hospice care. I'm sure maybe I have stuff that I can mentor and train people on, especially now that I've done this for a decade. But I can promise you, I'm getting way more out of that from learning from them. So I think that's the big thing, is not only being able to share, but learn from others. So I think hopefully we're hitting the mark pretty well on that.
No, I think you did. I mean, the tone you set with your leadership style, it creates this culture of inclusiveness, fun, but you're also like empowering us to grow as well. For example, when I first started, you took me out for coffee just so we can get to know each other a little bit more. No CEO or boss of mine has ever done that in my past before. So I thought that was pretty cool. But then also you do these different types of, I guess you help our employees grow. For example, you have the wellness challenge. So I think that's pretty cool. I mean, the step challenge that we have, or we get points for, doing different types of exercises. And then, to get a bonus out of that, at the end of the month, if you reach, the points goal, I mean, that's pretty amazing.
And you brought up really two programs I'm really, really proud of. The Coffee with the CEO program, really, I do that with all our new employees. After they get their feet wet, we go out and we have coffee or something like that. One, I want to get to know the employee, but I also want them to get to know me a little bit. I mean, how many CEOs take the time, you've probably seen it in some of your other jobs, that
Probably not many.
yeah, to really get to know the person. But part of that is, I guess, maybe a little bit self-serving in the fact that I want them to know what we're about as a company, because I want them to believe in it. And I want them to be able to understand that, hey, we're doing something and we have a mission and there's a reason behind we're doing it. And I want them to understand and be able to ask questions. But yeah, we get to know each other. The wellness thing that you talk about, and I'm glad you brought that up, because that's one of the things that I think that a lot of other companies could do too. That's so easy. Every year, fitness is an important part of my life. And I think that, it's helped me not only be probably healthier, but it's helped my mental health. It's hopefully going to give me more days on this planet to spend time with my kids and my grandkids and things like that, and do things. I like to adventure. I like to do stuff like that. But we see so many times where people have missed that in their life, and it's put them maybe in a bad situation with their health and ability to do things. So I'd like to set the example there. So it's so easy. We used to do these like maybe once a year. We spend 2 or 3 months and do these fitness, wellness things, and we focus on financial and mental health and physical health. So we just decided to run it year round. And just so the listeners know, you get points for your steps, and you cannot get enough steps to get a bonus. You get a financial bonus every month if you reach that milestone. If you're just walking to the refrigerator or to the bathroom, you're not going to hit those points. You're going to have to intentionally go out and increase your step count to be able to get those points. And I can track that through people's fitness trackers. It's so easy. It goes through our app, and we see that. And when they reach a certain milestone, they get a financial bonus. Then they could take a little bit further, and just by a little bit extra work, they get an additional financial bonus every month. And, we give additional points for, like you said, anything that's physical activity oriented that's not necessarily steps. So you're going to the gym and doing Zumba, or you're lifting weights, or you're playing golf, or you're paddle boarding. Anything that's getting you out and getting you moving, in addition to those steps, you get those additional points. So super proud of that one. And I've seen lives change in our business where people have totally changed their lives physically and mentally through these types of programs. So I love that. And by the same note, we want to encourage people to go to school, advance their education. We have so many people that do that too. We're going to support that as well. But I think the fitness challenge is just an easy way to kind of start that process.
And you highly encourage us to volunteer too, from what you told me.
Yeah, well, and we do. If you give an hour, we give an hour of our time. So an hour of volunteer of your own time, we'll match it with an hour of paid time, with that. And that's just part of where I came from. I'm really involved in the community, and I've always volunteerism has been a huge part of, I think, who I am, and it's helped develop me and help me grow. And every community needs these types of things and people to step up. So if we can encourage it, we try to do it. And I know a lot of other companies do that as well. But yeah, proud of the people we have that step up and volunteer for something outside of our business.
Yeah. And one other thing that I noticed in the culture of the company is that we do a lot of employee recognition. One of my favorite things is that when an employee starts working for Basin, we always take a time in the morning to, get a little bit of their favorite treats that they enjoy, and then we all come together and we recognize the new employee and we celebrate them for joining the company. I thought that was pretty cool.
Yeah, and the funny thing about that is we'd always do these going away parties when people leave. Well, sometimes, people are happy that person's leaving, or they're, whatever, you always get these different emotions with that, where employees leaving, who knows why they're leaving. But man, I'll tell you, we are so excited about people always when they're starting work. And I do think that that's one of the things, if you're going to have a going away a party for somebody, which, people leave for different reasons, and maybe they're bettering their life, and they're doing things like that, which I'm happy and proud of. But I really want to start the foundation of that employee's experience with celebrating them and being able to have a little bit of a party for having them there, because right now, it's important for people to work and to step up and come in there. And we're glad that they chose our team and joined our team to do that. So we're going to celebrate a little bit.
Awesome. I'm incredibly grateful to be working for Basin too, because of the amount of community service that we do. Recently, we just had the Christmas in May celebration for some of our past hospice patients who had passed on, and we brought their families to the workplace, and we did a whole commemoration of them, a ceremony, and then we released some butterflies. So I thought that was pretty amazing to experience.
Yeah, we started that, well, I started Christmas in May after my sister had passed away to recognize her. And then unfortunately we had a couple other employees pass away not long after that. And we decided if we were going to do this, why not invite the hospice patients' families as well? And we actually have a hospice garden where we memorialize them through a brick that we put in there, and some things like that with their family member's name. And but it has become a powerful thing because we all share that loss of a loved one. Yeah, this year was special for me because we just did it this week. You just experienced it. It was the 10-year anniversary of my sister's death, and I talked a lot about how, grief, it comes and goes. It's a lot harder when you initially lose a person, but it's still pretty hard later in life. It just doesn't hit as often. You have that grief button and it hits. But this year on the 10-year anniversary of my sister's death, this is fun. She was a big Duran Duran fan, and I'm not. But there's a music festival I try to go to as often as I can every year, and it's back in LA when I worked for Team Rubicon, I had a place there and I commute. I love that South Bay area, and I'd skateboard on the Strand or go run and in the morning watch the sunset. I love that area, and there's this music festival. And this year Duran Duran played, and I wasn't going to go because I'm not a Duran Duran fan, and I just never liked him. But my sister loved him. I mean, she was like a groupie. So I've always lived my life really adventurous and trying to do more, especially after she died, because she can't. And a lot of stuff I was doing, like if I go out and spend 3 weeks in the Grand Canyon, raft in the Grand Canyon, she would never do that. She wouldn't jump out of an airplane. These are things that I do. Well, when Duran Duran was playing, I was like, I don't want to do that. And then I thought, well, she would have wanted to go. She probably tried to get me to go. Hey, Vince, it's your favorite festival. So I went, and I talked a lot about that at Christmas in May, and about how just thinking about her and, how she would have experienced that. And I'll be honest, I sang some songs. I maybe danced a little bit with all the groupies and stuff, but I was there from the start to the last note played, and memory of my sister, and talked about that at Christmas in May. And but we do other things in the community too. I mean, I really think one of the most important things people do, well, one, I would just say, people complain about things where they live or in the country or wherever it is, but what are they doing to make it better? What are you doing? Are you starting with yourself? Are you trying to make yourself better? Are you trying to make your family better? Are you trying to make your business better? Are you trying to make your block better? Are you trying to make your neighborhood better? Your where you live, the town you live? And a lot of that comes back to giving back. And, when you and I first started this conversation, I talked about you coming back here after you got your master's degree. I think that doesn't happen organically by itself. It happens because people invest in this community. And one of the things I often say is, these youth sports like, baseball or whatever, you do not see Amazon on the back of those jerseys. You see Basin Health Companies. You see all these local companies who are sponsoring these teams. We need to be investing our time, energy, and money in this community to make it as good as possible so that people have a place in it. And so, once again, it's selfish for me because I want to be a great place for our employees to live and be able to stay. I want to attract people who are going to be future employees maybe, but I want them to love it. I want my kids to stay here, my grandkids to stay here. So yeah, anything we can do to do that, I think is a good investment financially of my time, energy, and money.
And I feel that spirit from the company too, because we've already been out through, at several functions here in the community, and your Basin's always donating. Basin's always donating either money or time, but we're always doing something to help the local community, the local businesses in the community.
Yeah, and I think that one of the things I almost want to challenge other businesses to do the same, because I think, there's so many generous businesses here in this community. I mean, the more I volunteer, the more I'm involved in this community. It blows me away. It's not just Basin. There's so many, but encouraging others to do more. I mean, even spending our money in this community, as opposed to, once again, I use Amazon as an example. You order something on Amazon where there might be a mom and pop shop downtown where they just need a few more cells to be able to make payroll that week. We need to be able to do everything we can to support these people because our friends, our neighbors, our family. So, almost like encouraging people to think about that themselves and challenge them and their employees. One of my favorite stories about that is we were going to buy new office chairs for our office. And it wasn't a huge purchase, but it was expensive. I mean, we were looking online, our staff was looking online for these chairs. And I said, hey, call this local company. I'll mention it by name, Parker's, great company. I said, call Parker's. Well, they're going to be more expensive. I said, just call them and see. And they called, and the price was the same. And they put the chairs together for us. If we had bought that from IKEA, I'm sure you bought stuff from IKEA and you had to put together.
Yeah.
That was huge. And they delivered these chairs. They're put together, they're high quality. And I talked to the owner of that business, and he's like, that was amazing. We got that. And I know Citizens Bank, they just built a new location downtown. They did the same thing. They outfitted that entire building with a local business. Those things are important, and they make the difference. I guarantee you that IKEA, Walmart, those companies are going to stay in business whether we give them our business or not. But these local businesses, they're going to appreciate it, and could make the difference in their bottom line for the year. We need to be doing everything we can there. So yeah, I love that. And those are the things that kind of you can probably tell. I get kind of excited about that, But like I said, they're our friends and our neighbors. We need to do everything we can to support them.
Yeah. And I get that spirit with other local businesses too, because I participate in the Farmington Chamber of Commerce, some of the activities that they put up. And the community's small because it's like typically the same people that are participating in those functions. And I'm really glad to be a part of that. It helps me to understand how important our local businesses are to sustaining the economy here in San Juan County.
Yeah, I think we're vulnerable, and it's important for us to do that. Especially now with the internet and things they're changing. I think it's important we think about those things more often. So, yeah, and I do think that, like you said, if we have these discussions and we talk about internally, we have policies of how we buy things local, that maybe some of our employees will think a little bit more about that as well and where they put their money. So, yeah.
All right. Well, I thoroughly enjoy that Basin does all this community service, but I know that you also do advocacy work too on the local, state, and federal level too. So I want to maybe just share that a little bit about that with our listeners.
Yeah, and I think it goes back to kind of what we were saying about local. So I started doing advocacy work for our industry at the state level because everything we do, prices go up, and everybody's really feeling it now. But we've been feeling it for years. Shipping costs and fuel costs and everything goes up. We can't raise our prices, and we get vendors all the time. We're like, hey, unfortunately, costs are going up, so we need to raise our prices. The only way we can raise our prices so we can pay our employees more and we can stay competitive a business is the reimbursement rates from Medicare and Medicaid. So I spent a lot of time in Santa Fe and Washington, D.C., advocating for our industry, trying to get more money so that we can continue to grow and we can pay our employees more. And what I've learned through there is a couple of things. One is a lot of people in our industry don't understand necessarily the importance of that, and they just think it's happening through lobbyists or, things like that. But them, one, getting involved in their local community, and then two, people see that and see the impact they have. So when they go talk to legislators, they know who they are and they know what they're doing. But I think it benefits us at Basin, but it benefits all my competitors. It benefits the industry as a whole. As I went down there, what I found is I can also advocate for businesses in our community. So in Santa Fe and DC, as a business owner, I'm advocating for the other businesses in town for business-friendly policies. And there's several examples we talk about with that, but I'm not going to mention, I'm sure we don't have time, but that is something that I love doing that has taken some time to really get good at. And what I've started doing now is, especially in the state level, state and federal, I guess, because they're going with me, is some of my competitors around the state are now doing the same thing in their own communities, and they're going with us. And we have a united voice. And telling the story from a business owner or as an employee, sometimes we get the caregivers involved and stuff so they can share their story, is a pretty powerful message, because legislators, they don't understand the impact of all these things. They get in, they have to wear many hats. And so it's important that somebody tells that story.
So I'm genuinely curious, and you don't really have to go in depth in this, but do you think that Medicare and Medicaid will increase the reimbursement rates?
Well, we were lucky in this last legislative session to raise our Medicaid reimbursement rates. We haven't had that kind of increase for decades, and it's going to make it, because we've fallen behind since COVID. 50% of the home healthcare companies in the United States are operating in the red right now. And that's, what ends up happening is you end up with these dead zones, especially in rural areas where there's not healthcare available. So it's really important to take care of them. So that was a huge help. So yes, I think it is possible, but I think we've got to be able to tell our stories and be able to go up there from the perspective of the people who are out there doing the work. It's so important. So we're going to continue to do that. And, I'll tell people, join your associations, because when you join these professional associations, you can get in there and they give you training, they help you, prepare you. Does it cost me a little bit of money to do that? Yes. Is the investment worth it? Well, I think it is. And so hopefully we're going to keep working at it, because our employees deserve it, and our patients deserve it, and our partners deserve it.
Mm-hmm. Definitely. Well, I know that kind of going back to our support of local businesses, you once mentioned this idea of co-opetition that you brought up with me, and I thought that was really intriguing, only because, like businesses, you would think that they would think of each other as, competitors, but actually we're actually doing a larger, a larger good for the community in some sense by kind of working together. So tell me a little bit about your idea of that.
Yeah, so I came up with that. I don't even know where I came up with it, but we're competitors. We're going to cooperate. So I called it co-opetition. I want everybody to be successful. I think the ones who are the most successful are doing things, maybe the right things or differently or whatever, but it doesn't mean everybody's not important and aren't providing a service to the community. They're employing people, they're taking care of patients, whatever. And it doesn't even matter what industry it is. We need all of them. And so, yeah, I think the cream rises to the top always, but that doesn't mean we can't support each other and help each other with resources, shared employees. I look at my competitors in this community, and I realize that my employees work for those other people. Maybe their employees are going to work for me. So I'm never going to trash any other employee, by the way. I think that's really important. It's not employee, but another business, because, people love those people too, and they have family and they have friends that work there. We've got to be able to work together. And so it's just an attitude, I think, more than anything, looking at them more as partners in healthcare, instead of someone who's always a threat to what I'm doing. I'm focused on what we're doing internally, creating the best product, the best healthcare, having the happiest employees, And then I'm sure they're doing the same thing in their own way. We're just taking our different angle at it. Yeah, I think that's so important. This community needs all the businesses to continue to support not only in healthcare, but other industries as well. People need places to eat. They're not always going to want to eat at a New Mexican restaurant. They need other choices. They're not always going to like the brewery that serves this. They might want the brewery beer at the other place. It doesn't mean they don't go to that brewery. I mean, they're all important, and we need to look at that as competition, I think.
That's awesome. So I know that we're running out of time, but there's one other question that I want to ask you, and I haven't been able to ask you yet. But what ripple are you trying to leave behind here in the community?
Oh, wow, that's a good one. A ripple. And I think I like that word because, like, when you throw a stone out in the lake, all the ripples it create. Well, I think I talked about a few of them. I think probably the one of the biggest ones is the ability to give back. Give back. I think it comes back. So if you give back to the community or you give back to others, it's going to come back. You give back to empower your employees, they're going to stay loyal. I've heard people talk that, this saying of like, you don't want to train that employee because what if they leave? You don't want to spend the money training that employee because what if they leave? And I remember someone one time said, well, what if you don't train them and they stay? And I think that's a really good example. If yes, the money we invest in the community, the money we invest in our employees, all these things, the time, the energy to go out there, we're going to miss the marks occasionally. We're going to have people move on, stuff like that, but it's still making the community better. And hopefully it comes back to us in spades. With that, I know by far that I still have tons to learn. I'm learning every day, and hopefully growing. I have a growth mindset, but I think that's the biggest thing is to encourage people to give back of their time, energy, and money, to be kind. You never know what other people are going through. It'll come back to you. It doesn't cost anything to be a good person. And really, that's more than just saying, hi, how are you, or open the door. It's invest your time, energy, and money in the places you live and you want to invest in. And for me, that's our employees and our business too.
Mm-hmm. I really like that. Yeah. The idea of reciprocity.
Yeah.
Yep.
Well, I think in the end, people have choices, right? And I respect that a great deal. And all I can say is if we have people from our business who leave, I hope that people say, hey, whatever they were trained and whatever happened to them before they came to us was a good thing because these are great people, great employees. And those type of people we have, and same thing with my kids. That'd probably be the biggest ripple though, is my kids. Right? That's your legacy when you live on. And one of the things I'm seeing now, I've got 3 wonderful children, 2 daughters, a nurse practitioner. My son got his MBA, and one of my daughters and my son are working back with us. I love working with them. I love seeing their style. I love seeing how kind they are. They're great leaders. They're doing their work ethic is tremendous. And I just can't wait to see what they accomplish. And my goal, and this is kind of the ripple, is that whatever it is better than what I did. And they have an opportunity to share that more. So, yeah, that's a good question. So thanks.
Yeah, you're welcome. Thank you. Well, I think that pretty much concludes our program today.
You got all your questions answered.
I did. Yeah. Thank you.
Well, good. Well, Tyrell, thanks for doing this with me the first time. Like I said, I know I put you on the spot, but you're a great addition to the team. I really look forward to working with you future. You've already been a great addition, and you're a good sport by sitting here with me and doing this too. So you've been a great guest on the very first podcast, even though you did the majority of the questions.
Well, thank you. Like I said, it was a privilege to do this, getting out of my comfort zone to, share this conversation with you. That's really where it's at.
All right. Well, good. Well, thanks.
Yeah.